Hello everyone, welcome to Alacrity Explains Anatomy. Today we are going to be looking at the anatomy of the rotator cuff muscles. By the end of this video, you will be able to identify the four muscles that constitute the rotator cuff muscles, describe the origin, insertion, innervation, and the primary action of each rotator cuff muscle, and explain the functional role of the rotator cuff as a dynamic stabilizer of the glenohumeral joint. You will be able to predict the clinical consequences of rotator cuff injury, including common tear patterns and muscle-specific weakness. Also, you'll be able to relate the anatomical relationships, the subacromial space, to the common pathologies like impingement syndrome. So, what then is the rotator cuff muscles? The rotator cuff is a group of four muscles that surround the glenohumeral joint or the shoulder joint. Now, the key analogy here is that it functions like a dynamic ligament or a muscular sleeve, right? That helps to support or hold the head of the humerus, which is larger, in the shallow glenoid cavity. So the primary function or roles of the rotator cuff muscles is they help in centering the humeral head into the shallow glenoid cavity, glenoid fossa. They counteract the powerful superior pull of the deltoid to prevent superior humeral head migration, and it also plays a role in producing rotational movement of the shoulder. So these are the rotator cuff muscles. We have the supraspinatus, we have the infraspinatus, subscapularis, and the teres minor. And the mnemonic is we have SITS. We have supraspinatus, infraspinatus, teres minor, and subscapularis muscle. So these are the four muscles, their origin, insertion, nerve supply, and the action. Supraspinatus originates from the supraspinous fossa. It inserts into the superior facet of the greater tubercle of the humerus, and nerve supply is by the suprascapular nerve with root values C4, C5, C6. The major action of the supraspinatus muscle is that it is responsible for abduction of the arm, and it helps to hold the humeral head in the glenoid cavity of the scapula, which that is also the general function of the glenohumeral, the rotator cuff muscles. We have the infraspinatus, which originates from the infraspinous fossa of the scapula and inserts into the middle facet of the greater tubercle of the humerus, has a nerve supply from the suprascapular nerve, while the action, it laterally rotates the arm and helps to hold the head of humerus into the glenoid cavity. We also have the teres minor. Teres minor is muscle located posteriorly in the shoulder, and it originates from the middle part of the lateral border of the scapula and inserts into the inferior facet of the greater tubercle, the inferior facet of the greater tubercle of the humerus, supplied by axillary nerve, and it laterally rotates the arm. Then lastly, we have the subscapularis muscle, which originates from the subscapular fossa, inserting into the lesser tubercle of the humerus, supplied by the upper and lower subscapular nerves. Upper and lower subscapular nerves supply the subscapularis muscle. And the major function of the subscapularis muscle is that it medially rotates and adducts the arm, helps to hold the humeral head in the glenoid cavity of the scapula. So now, what are clinical correlates? These are just the rotator cuff muscle. What are clinical correlates that you need to know concerning what we have talked about? We have the suprascapular nerve, which we say supplies the supraspinatus muscle and the infraspinatus muscle. Now, the suprascapular nerve passes below the suprascapular ligament and enters into the suprascapular fossa, then passes through the spinoglenoid notch and enters the infraspinous fossa, where in these two spaces it supplies the supraspinatus and the infraspinatus muscle. So now, Whenever there's an injury to this nerve, maybe from a suprascapular notch compression, it will cause weakness in the abduction. Remember we said in earlier slide that the supraspinatus is responsible for abduction of the arm, while the infraspinatus is responsible for lateral rotation of the arm. So if there is an injury to this nerve, there's going to be weakness in abduction as well as external rotation, which is another name for lateral rotation of the arm. Now, what are anatomical relationships to the rotator cuff muscles? We have the subacromial bursa. Subacromial bursa is lies between the supraspinatus tendon and the acromion, or the coracoacromial ligament. It protects the tendon from bony friction. So we have also the supraspinatus tendon passes under the acromion. If you look at this is our subacromial bursa, which is between the supraspinatus tendon and the acromion itself, while the supraspinatus tendon passes under the acromion. The tendon is located under the acromion. So this is the most common site of impingement and tear of the supraspinatus muscle. Now let's look at important clinical correlates. We have the rotator cuff tear. Rotator cuff tear is a tear of the rotator cuff muscle. It's the most common clinical correlate of the suprascapular muscle, supraspinatus muscle. And here basically what happens is that there is the supraspinatus tendon is torn, is especially in the hypovascular or critical zone, which is 1 centimeter proximal to the insertion point, and this can result in a fall on an outstretched arm or due to repetitive overhead motion in people or people like athletes and painters, which their jobs involve consistent abduction that leads to overhead motion of the arm, like athletes and painters. So how does this condition present? It presents with pain, with abduction, especially in 60 to 120 degrees, which we call the painful arc. And there's also night pain, weakness in specific motions like external rotation in infraspinatus tears. So this is a rotator cuff tear. It can be a tear of any of the rotator cuff muscles, most commonly the supraspinatus muscle. And in this situation, there will be pain felt when there's abduction from 60 degrees to 120 degrees. So we'll call it the painful arc, sometimes referred to as the mid abduction. In the middle of abduction, pain is felt. So we have the impingement syndrome, which is repetitive compression of the rotator cuff tendons, especially the supraspinatus, against the acromion. This is the subacromial bursa, acromion, and supraspinatus muscle. When there's repetitive compression of rotator cuff tendons, can result in impingement syndrome. Thank you for watching. Don't forget to like, share, and subscribe to Alacrity Explains for more videos. Thank you.